Looks like we're live now.
Yep.
And I'm just waiting for it on. I do not see it on. There we go. Now I see it on Instagram. Perfect. I think we're live now completely. So, how's it going?
It's great. I'm super excited to be here today. This is a topic that I've been excited to talk about for a while because it's not in the total thread of what we've been doing lately. So it's a little different.
Yeah, absolutely. I think IUIs, I think the thing that would be good for us to kind of talk about tonight, I really hope people come on, just to remind people again, this is the last day to get in the raffle. So if after this, we're pulling the winner. So if you want to be in the raffle, make sure to at least ask a question or come on live. I think with IUIs, it's really interesting. And you probably get this question a lot. I wonder if you get this. I get people ask me all the time, like, should I even do the IUIs? Because they never work. My friends did some of them and they never got pregnant. And there's almost this kind of feeling that like IUIs don't work. But I think one of the things we're going to talk about tonight is just like, statistically speaking, they're not super high chances either. So it's not like each IUI is going to be a high chance. And so I think sometimes they can be very discouraging. I totally get the point about, costs of like, if I'm spending on IUIs, then it could be going to the IVF. And so, for anyone who's just joined doesn't know what an IUI, intrauterine insemination, means injecting the sperm in the uterus. And so I'd love to, I don't know, you want me to start, or if you want to start and kind of give our 2 cents on IUIs.
Go ahead and take it away. And I definitely want to come back to this point because you touched on it about the cost of IUI. So we'll just like throw that little nugget out there and we'll come back to it later.
Yeah, we'll come back to that. Absolutely. I think the thing when it comes to IUIs, intrauterine insemination, is that they have a very good purpose. And that purpose is that, especially for like, men with mild sperm issues, even unexplained infertility, I think is fine. For me, there's different reasons we do IUI. So like, for example, and I think people get to kind of see our insights here. So if I see an insurance patient and they've been trying for, let's say, 6 years, in my mind, and I can't find a cause, to me, doing IUIs is a waste of time. I tend to find that after 2-3 years, unexplained infertility, rarely is IUIs going to get someone pregnant. But insurances require us to do them sometimes. And so we have to go through the motions. And so sometimes I feel like when people hear about those cases, like, oh, well, my friend did again, she did 3 of them. Well, but I wouldn't have recommended 3 of them. It's just we had to do it because that's what the insurance required, And we'll get into that too, like that nugget of, how many do you do? Do you do 3? Do you do 5? Do you do 8? But I generally think IUIs are great for a few groups of people. One, again, is sperm issues that can be fixed with an IUI. These can be like mild sperm issues, motility issues. I think one of the things people forget about sperm is everyone's always worried about counts, but rarely is that usually the problem. Usually it's like the motility is bad, the progressive motility is bad, the concentration is low. All these things can affect your chances. And so if I see that, I think an IUI is a great option. I've had many patients that want to go on IVF. I'm like, you're crazy. Do an IUI, and they get pregnant, in the first, second one. The other group is, I think unexplained is not a bad category to go in, but I think, again, I tend to be like, I've been trying for a year or 2 and there's no other things. Outside of that, I don't think they're really worth doing it outside that. I find like very few people get pregnant. Statistically, I tell people that, each IUI gets them somewhere between a 15 to 22% chance. Now, that number is a little higher than some other places will say. And the reason that is because I am a little bit more aggressive. But to a point, if I get a 22-year-old who comes in and, they've been trying for 6 months, I'm not going to put them on, Clomid with injections and stuff. I'm like, you get Femara or Clomid in the lowest effective dose, and we'll give that a shot. And then if that doesn't work, we can be more aggressive. But, when I get someone who's 36 or 38, who's had 2 years of trying, or something like that, I'm more aggressive. I do. I try to make more eggs. I try to make it based off of their age. And so I give people about that 15 to 22% chance because I know that with me being more aggressive, there is a higher chance. But with it comes the risk of things like multiples. And so luckily, I've been very fortunate not to have many multiples of my IUIs. I feel like I choose the right patient. But one of the things I'd love to talk to you about at some point, and again, I think right now we just got to kind of explain things to people, but I think sometimes IUIs aren't used correctly. I think a lot of places it's kind of this like, we're just going to give them Clomid, give them Femara. If it works, it works. If it doesn't, then they're going to IVF. And I'll see these patients. So one will be 41 years old. One will be 22 years old. Exact same treatment. Nothing changes. Yeah. Exactly the same. Or like the ultrasound, right on day 12 every time. Doesn't matter. You know, they could ovulate one time. They still bring them the same day. So I think when you customize it and you look at the patient and you adjust it, I think it does make a big difference. And you can have a higher pregnancy rate. And there's just some people who, you know, shouldn't do them. And I definitely, we have a lot to talk about. Before you jump into it, I saw there was something about someone asking what's the raffle. So just in case anyone not sure. So for the last several months, we've been doing this show, and anyone who comes on the show and talks, and you don't have to show your face, will get 5 entries into this raffle. If you send a question, a question will get you 1 entry into the raffle. So, you know, just ways to get this raffle is going to be for something quite large. So it's going to be, for example, have to do with IVF. So such as like, you know, 50% off or small IVF. So it's a very big raffle being given away. We're going to be doing lots of these over time. And we're just going to basically, as you come on, you'll be entered, and then we'll say, okay, raffle's going to be happening this next week. And so we don't want to like give dates. So just so everyone knows, it is random happening, but this is the first one that we're doing. It's a pretty big one that we're going to be giving out. So if you're interested, like I said, please send those questions. Anyways, if you want to answer that, and you know, what's your thought on IUIs? I mean, how do you recommend them, and what's your kind of, you know, algorithm?
Yeah, no, definitely. I mean, you know, I think the first thing that is that this is kind of like the original kind of artificial, you know, assisted reproductive technique, right? Like this goes all the way back, you know, to the 1800s, I believe, when they first started kind of experimenting with these techniques. I mean, when you compare that to IVF, which was really 1978, that was the first, you know, case of IVF that took place over in Cambridge when they did everything. And so you see that, you know, IVF has been around for a little while now, but it's nothing compared to these other techniques. And I think that's interesting, right? Because I think it just gives you some idea about, you know, these are not created equal. Like one of them uses a lot more technology, and we needed to develop the science and everything to get to the point of being able to do IVF. And before that, we really didn't have all that much other than surgery and IUI. Now, that being said, it's exactly like you're saying, Dr. Amols. I mean, I think IUI, it's all about making sure you select the right people for IUI. That's so key, because if you end up finding out that, you know, a couple, again, I think you mentioned this one, you know, like an anovulatory couple with PCOS, you know, young couple, sperm looks great, everything's fine, but they're having trouble aligning the stars, because it's hard to know when you're ovulating, because you don't ovulate, you know, frequently enough, on time enough, etc. And you're like, how do I make sure we're having sex at the right time and everything like that? Then we say, okay, well, IUI is a really great way to do this, because you have the benefit of ovulation induction medications. You've got the benefit of ultrasound monitoring. You've got the benefit of making sure that we stay on top of your lining. And then we optimize the sperm. I mean, we give the sperm a huge head start, so that all they have to do is just go a little distance to get to the egg. And it's amazing. I think it's about, you know, within 90 seconds to like 3 minutes, I believe it is, that the sperm actually gets to where it needs to go to surround the egg. So that process happens, you know, very, very quickly. So that group of women with PCOS, great group that, you know, can benefit from it if they're, again, young enough with good sperm, and we believe that that's the only thing going on. That could be a good group. You know, another group is, you know, maybe very borderline male factor issues. So these would be people with low counts, but not so low. Once you drop below like a total modal count of 8 million to 10 million, you really start seeing those success rates, you know, kind of decrease a little bit. And that's when you get into the territory where IVF becomes a lot more, you know, it just becomes so much more efficient. You know, another group of people is that unexplained group. The unexplained group is tricky because they're unexplained. So if, let's say, they have a fertilization issue, the sperm isn't actually getting into the egg, then you're not solving anything with IUI. You're just putting a lot of sperm by the egg, but you're not solving that fertilization step. That's a big part of IVF. It solves that step. But on the flip side of it, if maybe there's like a very mild cervical factor issue, or there's some other issue that's going on, yeah, then maybe it's good. There's another group that I think benefits from this, and quite frankly, I think this is a group that is under recognized, and that's the group that has a hard time timing it, right? Like, sex is stressful when you're trying to start a pregnancy, especially if you've been trying to do that for a while, and it starts to kind of lose the spontaneity, and it can lead to some elements of like sexual dysfunction. And so sometimes, honestly, just taking the pressure off by saying, we know we're going to do IUI, it can really help a lot with optimizing success rates. I agree with you. I think the success rates, are not super high, but that's not because the technology is bad. That's because that's the biology of reproduction. We're just not naturally that fertile as human beings, and that's okay. So I quote generally, again, depends a little bit on age and everything, ballpark about 15% per cycle. And one of the downsides, but of course, for some people, it's an upside of IUI, is this risk of twins. And even in certain cases, now this is very rare, you could even end up with triplets or more, because you're ovulating multiple eggs, 2 eggs, maybe 3 eggs, and there are many sperm around. If things go a little too well, that's what we end up with. So yeah, what's your take on the multiples aspect of all of this? Because we always talk about it with our patients.
Yeah. Well, I think I want to comment what you said exactly. I think a couple groups like, donor sperm, obviously another good case of using IUI. There are certain cultures that intercourse is used just for having a baby. And so for them, you're right, the timing is very difficult. So I think it's good. I think another thing to understand too is that when sperm looks good, I think it's really important people understand it doesn't mean the sperm is good. So when we say guy's sperm is normal, I don't even care if they tell you that your husband's sperm looks like Superman's sperm. That does not mean there's not problems, because it didn't put the sperm through an obstacle course. It just means their numbers are good. And as I always make the joke and say, like, you can say, hey, Dr. Amols and Dr. Salem look like nice guys, but doesn't mean we are. It's just the way we look. And so sperm can look good and still have problems when it comes to game day. Apologies about my voice.
Nice guys. That's nice.
Yeah, you are a nice guy. I could definitely say that for sure. It's funny. I did a podcast yesterday about twins yesterday, and I was actually talking about like the difference between identical twins and fraternal twins and what causes them and stuff. I think if you do it correctly and you base the number of eggs off of the person's age and their situation, I think it can be done very safely with a very low risk of twins and an extremely low risk of triplets. I'm not saying I've never had twins with IUIs. I'm not saying I've never had triplets. Almost anyone I have twins with, I let them know that's a possibility. I tell them ahead of time, like, hey, this is a possibility. You can do. Are you okay with it? I would never force that on anyone. And me, I'm not against twins. I'm never, I'm not part of that group, but I do think there's reasons to, not have twins. I think there are situations, but yeah, my thought process is that it should always be appropriate is what it should be. Like if you have a 43-year-old they're doing IUIs with, I'm not afraid to make 4 or 5 eggs. Matter of fact, I'm shooting for that because I know statistically I'm going to need 7, 8 eggs to get one good one. But on the same token, if I got someone who's 22, even if they've had a lot of eggs and haven't got pregnant, I know that whatever's causing them not to get pregnant isn't just another egg. Meaning it's not like their body's sitting back going, man, we really appreciate these last 3 years of eggs. 36 eggs. Yes, awesome. I'm not going to do this unless I have 4 eggs. Not going to let this happen. Like, that doesn't make any sense. So the problem is that those people not getting pregnant, if I make too many eggs, whatever that issue is, fertilization, like you said, maybe the tube stenosis or something like that, the egg wasn't getting picked up, but that 1 month it does, boom, now you have 4 or 5 babies in you. And so different people you can be more aggressive with because you know statistically what's going on there. And so that's how I kind of look at that. I know we have someone who's interested in getting on here, and so I'm definitely interested in getting some, because again, please remember this is the last show before the raffle draw. So make sure if you're gonna get on and get your 5 raffle things, get in. So let's we'll pull Sammy up here and bring on screen. And Sammy, it looks like you're muted. Oh, there we go. Hey Sammy, how are you doing?
Fine. How are you guys doing?
Good. Thanks for joining us.
This was just really me randomly jumping on. I got a notification on the Instagram, like, new fertility has a live air. Like, let me jump on.
Well, we would love any questions. What makes this show more fun is when people ask questions, because as I always tell everyone, Dr. Salem and I, we think of what we think people want, but it's different when it comes from patients. It opens up discussion that we weren't thinking of.
Yeah. Well, I have a question. So I have been on this fertility journey with my husband now for about, through actual fertility treatments, 1.5 years. So I'm a new patient to your clinic. I was referred by my acupuncturist, Dr. Johnson. So I've set up basically I've met with Dr. Johnson. So I had more success with an IUI. Unfortunately, I miscarried about 7 weeks. And then recently I did IVF. So I've done 1 round of IVF and I'm like, whoa, this is no joke. So my question is this. So how long should you wait to do another egg retrieval? So I did a transfer back in July 25th. Unfortunately, it came back as a negative pregnancy test. So, I guess I was recommended, just because of my age, just to make sure I have eggs at my age, to do another round of IVF. And I don't mind, but I can be a type A personality where I'm like, okay, let me just go. Let me get those eggs out. I'm 38, we're not getting younger. Let's go. But I guess my question, I know when I was speaking with my acupuncturist, she was kind of referring, maybe wait a few months, because I was thinking I'm going to start in September, try to do your egg October. Like, what is the best protocol? Like, should I really give my body at least 1 or 2 months after I've gone through 4 months of the whole IVF process? Like, what do you recommend from your perspective? So I guess that's my question.
Yeah, I mean, I can tell for sure, Dr. Simon, both of I will tell you that you always want to, talk to your doctors. They know your situation the best. But what I can tell you is that there are times there is a benefit to wait. So if it's a quality issue thing, then you want to focus on quality, and that's not going to happen overnight. You do need some time for that to improve.
Okay.
Sometimes it's not a quality issue, right? So let's say, for example, you do an IVF cycle and none of the eggs fertilize. You do standard insemination, none of the eggs fertilize. Well, there's no reason to wait now, because now you just need to do ICSI the next cycle. So that would be a situation where you can go, I'm just going to go right into it. So it really does depend on the situation. I have many patients where we'll just go back to back because we know it's just a numbers game. We've got to get enough eggs to eventually get there. And then I have other patients where, we don't get what we expected, and we know there's some other underlying issue. And so we got to look into it, take some time, improve things. So I couldn't tell you what to do, but what I can tell you is that those are the type of situations that you're looking at and how you're making adjustments. I'd love to hear Dr. Salem's view on this as well.
Yeah, I mean, it's such a great point, Sammy. And, I think this is something, I'm glad you brought this up. A lot of people think about this, about let's just say more generally, the transition between different things. Because I did hear too, like you said, you had that miscarriage, very unfortunately. I'm sorry about that.
Thank you.
And yeah, and it can be so difficult to go from one thing to the other to the other. I kind of put things into kind of 2 buckets. The first bucket is, what you need as an individual, your scheduling, your emotional bandwidth, your financial bandwidth, all these things. And sometimes people just need an extra month or 2 or even 3 to kind of just like move on and get back into treatment and do these things. And at most ages, waiting the 1, 2, 3 months is okay.
Okay.
We're not losing so much time from an age-related standpoint that it's going to have some big detrimental impact. The other part of it is medical stuff. So just like Dr. Amols was saying, I completely agree with that. Like sometimes we're trying to like optimize lifestyle things. We're trying to clean up, some habits. Maybe we're trying to eat healthy. We're trying to add supplements. We're trying to use, acupuncture for a couple months. And I think for some of those things, if you want to optimize all of those things and know that you gave it your best shot at optimizing that, I think it's very fair to wait a month or 2.
Okay.
I think from a medical standpoint, there is no harm and there is no benefit necessarily of going back to back to back cycles. But for some people, it just makes sense to do that because, many of our patients it's a numbers game. They need to get more eggs and they don't want to drag out this process any longer than it's already gone. And we try to help them actually get in more quickly. But for other people, maybe they just really want to focus on those lifestyle things to improve quality. And that's a conversation. Again, it's best to have that with your doctor because they know your full case. So they balance those things.
Okay. Yeah. Thank you. No, I am trying to set up an appointment because originally with Dr. Johnson, because I know I'm coming from a new clinic. So yeah, that's where I was kind of like, am I pushing it? Do I do I wait? All those things like in my head were running like today. So when I saw you guys were live, I'm like, oh, what's this? So thanks for your insight. So yeah, I will follow up with Dr. Johnson and see what he says. Cause I know prior, at least in my other clinic, they didn't mention anything about egg quality. I know one cycle I was able to get 12 eggs, 10 matured, but only 5 fertilized. So just I'll follow up with the doctor. Thank you.
Thank you so much for being on.
Yeah, thank you.
It's interesting. It's funny. Like these things are things that we just do naturally. We don't even think about. But it's a good question. Like, well, when do you just go right back into it? There's times when it's actually very useful to go straight into it. Like, doing a back-to-back cycle or even a luteal phase cycle. But there are times where I've had patients where just taking off 3 months and improving lifestyle and things like that can make a huge difference if it's a quality issue. And that's the thing I think is really important. Some people, it's not a quality issue; it's just a numbers game, and there's other things you can do as well. But another great question. I was looking at one of the questions that someone was asking, and it was on the Instagram. And it said, why has it been recommended that 3 rounds of IUI is best? We did go through 3 rounds, but no says that now in our second FET. And so I think that's a good question. Like, where does this come about the 3 rounds? Because, before a certain study came out, it was kind of like people just keep doing the IUIs. There's still people in town who do like 6 IUIs. And so I think it'd be nice for us to kind of like explain where does this come from? I think the first part it's important people understand is they're not super high chances. Even being aggressive, you're talking like 22% the best, best chances. And so since they're not very high chances, it does usually take more to get there. So whereas like IVF, 1 transfer, 60% chance of live birth potentially, IUI best case 22%. And so that means if you're having a 20% chance, you have 100 people afterwards, 80 people aren't pregnant. That means out of 100 people who do, all of them do an IUI, and best case scenario, 80 of the people will not be pregnant. Do another IUI, and now 64 of the people are not pregnant. And do one more IUI, and now 51 people are not pregnant. So the amount getting pregnant each time is smaller because theoretically there's a smaller pool to pull from. But the point is, even after 3 IUIs, best case I tell people is 50%, and those are when I'm being very aggressive. And again, if you're doing like just Clomid or Femara, it could be 12, 15% chance for that IUI. And so the reason for more of them, and I tell people, love to see what you think, is I tell them, don't look at the IUIs as like, I always, even on the first IUI, I tell them, don't get your hopes up too much. Meaning like, yes, we want it to work, but don't feel like if it didn't work, there's something wrong. Because I can tell you, like my wife and I, we had very, like my sperm is horrible. I mean, I tell people all the time, like I can't, it's just horrible. But I got it at one point. I did this procedure, got back up. I was like, oh my God, maybe we can get pregnant with IUIs. So we tried IUIs at Mayo. And it's weird, as a patient, it doesn't make sense. You're like, okay, we just put all the sperm in there. It only takes one. We put millions in there. We made multiple eggs. How could it not work? And it goes back to that point you were saying, if it's one of those things that can't fix it. And so that's where that kind of question is, how many do you do? Do you keep doing it until you're just exhausted, or is there a point where you call it? And so I don't know if you want to talk to people about like, why is it that we only do 3, or why do we recommend 3 versus just doing 1?
Yeah. Yeah. No, I mean, this goes back a long ways. I mean, we can geek out about some different parts of it. I mean, one part of it is about, let's think about not the medicine, but about the cost of it, right? So there were some studies in different places where they were trying to figure out, hey, can we just keep doing a ton of IUI, and eventually people are going to get pregnant and they're not going to need, higher level type of, things like IVF or ICSI and all this kind of stuff. And this was done in Massachusetts. So it's a little bit of like a little fun history trivia. And the idea there, because the state mandates that IVF is covered, they wanted to make sure that only the people that were absolutely needed IVF were getting IVF. So they forced everybody to go through 6 rounds of IUI. Well, going through 6 rounds of IUI takes minimum 6 months. I mean, that's if you do everything perfectly. Like, I think on the ground, it probably takes more like 8 or 9 months, because there's going to be a missed cycle here, or you're going to have to cancel here, or travel plans or whatever. So, that seems like a lot of time, to be, totally honest, to have to go through IUI to just find out that at least half the people still need IVF. And that's kind of what the studies were showing broadly, that, you still had a huge number of people that still needed IVF. Now, the other way to look at all of this is, so when you do each round of IUI, and again, I mean, Dr. Amols is, you're very, very good at picking the right candidates. Because I think, at 22%, which is true, like your rates are really high, but you're selecting your patients really well. The published rates hang around 10 to 15% per IUI cycle, right? Like that's the national published rate. So that's kind of when you're like not really selecting, and you're just saying like, let's push everybody through IUI. Everybody gets the same protocol, and we're gonna, try our best, triggering always roughly at the same time, let's say. So if you do it that way, you're gonna have a little, at most, a little less than half of people are going to get pregnant after those 3 cycles. But it's kind of this idea of diminishing returns. Like after you've done 3 rounds of IUI, you've probably captured everybody that's going to get the most benefit from IUI. So I tend to see that, in cycles 3 through 6, the per cycle success rates do go down. I think for the first 3 cycles, broadly speaking, you see kind of equivalent success rates, because you're still chipping away at the group of people that are going to benefit the most from IUI. But, once you get beyond that, it's not as good. Now, the other part of it with IUI, of course, is, let's say you do unfortunately end up having a pregnancy, but it leads to a miscarriage. Well, that is more time that you're spending in treatment, right? Because with IUI, you unfortunately can't control for a genetically normal embryo. You can't control for a few other things. There's a question that I think we're going to tackle here a little bit later about somebody who had a vanishing twin. And, that's one of those things that, again, it's like if 2 eggs are fertilized, that can happen. And then one of them can kind of be reabsorbed in the body. And so, again, I feel like a lot of us in the field have sort of slowly kind of coalesced around this 3 cycles of IUI being a good number, a fair number. But I always tell my patients, I always say, if at any point you've kind of had it with IUI, you want to talk about, you know, taking the off ramp to IVF, I think that's a fair conversation. Don't feel like you're locked in to 3 rounds of IUI just because you said you would give it a try. And I think, you know, I think that's a fair way to look at it.
Yeah. You know, there was a study obviously done out in Boston where, well, actually it was in Massachusetts. I think it was in the area of Boston where they were looking at, you know, when do people get pregnant? And what they looked at is they did a retrospective study where they looked back at all the people who got pregnant and all the IUIs done, because it was a mandated state. So in mandated states, usually they're going to make you go through IUIs over and over because they don't want to pay for IVF. They want, you know, rather get pregnant with IUI. And when they look back, they did find that of the people who got pregnant, so we just took only the people who got pregnant, 90% of them were usually pregnant in the first 3 to 4 cycles. And so that's another area where people just go like, yeah, you can keep doing it. I had a patient one time, their insurance did not cover IVF, but their insurance covered IUIs. And so when we got the 3, they're like, should they go to IVF? I said, yeah, I would normally recommend it, but your IUIs are covered. So, I mean, there's no harm other than just time. They were young enough, they had time. And actually on the 5th IUI, they did get pregnant. And it happens. 10%, you know, of the people who get pregnant will be in that point. So, but you are right. There's that general kind of consensus now that most places are like 3. And even with insurances that require you to do 6, you can usually argue with them and say 3 is enough. They're like, yeah, 3 is enough. And then they'll let people go on to things IVF. The only caveat I would say, and I know this is a little different than what I will talk someone into at least doing IUI if I think it will work. I don't have anyone do IUIs other than insurance required that I don't think IUIs will work. And so I do get patients after just one IUI not working, one to jump to IVF. And I tell them, you know, don't jump off yet. Like I know it seems like, you know, so crazy how it couldn't work, but I wouldn't jump off yet. You know, give it at least 2. Because again, 80% of people, even in the best case scenario, are not going to be pregnant. So I feel like you got to at least give it a little bit more shot. So I see we have some more people here, which is great because, again, this show is more fun when people come on, and we love it more too. And again, just means that we're getting more entries in this raffle here. So let's see. We got Ashley here. Hey, Ashley, how are you doing?
Hi. Hello, hello.
How you doing?
Thanks for coming on.
Thanks for having me. Thanks for having me. My husband Paul's here as well, and we've been on this journey for quite some time. But blessed to be in good hands with Dr. Amos after being at another facility and coming over. But just experienced a failed transfer, and just looking again, we're excited and motivated to move forward, but it's still emotionally taxing and challenging, and just wanted to get your take just on like how to handle the emotional piece of it for those that are going through IUI or IVF. It's all taxing. The journey is varied for everyone, but just looking for what are some of those support resources and things that we might want to take advantage of for both partners involved.
Yeah. It's interesting. I think this is one of those things where there's so many things out there and you almost have to find what works for you. One of the examples I give you is when I was a fellow, I was doing transfers with another doctor. And when we went to go do the transfer, something happened, the device fell apart and the person's embryo died at that moment. And unlike now where day 5, you can sit there and just go, thaw another one. Back then, the embryos were actually grown out. So they're frozen at what's called the PN stage. And then they grow out for several days. So the transfer was over then at that point. There was nothing we could transfer. And I remember when we were in the hallway and the doctor was giving me a really hard time. She's like, how come you don't care? I'm like, I do care. I'm like, I feel horrible. And she's like, well, why aren't you crying? I go, I'm internalizing, like we all deal with things different. And it shocked me that she would accuse me of not caring because I wasn't doing what she would do. And I think that's the really important thing to understand when it comes to, talking to people. Some people need to talk. Some people need to see a therapist. Some people need to, just go out or do stuff. And I think you have to kind of look internally at what helps you. And there's so many resources. Even we created a Facebook group for, and we don't even control it. The patients control it, but we just created one for just our patients, just to be able to talk to some of our patients, because we wanted an outlet, and we wanted them to be able to talk together. And so I think you got to find what's right for you. But most important is, I think it's always important as couples, and I've actually done several podcasts about this, where it's important to understand that your partner may not deal with the same way you do. A partner may just get quiet, and stuff like that. And so it's always important to never look at your partner and go, why are they upset like me? They might be just as upset, but the way it shows. And so that's where I think, if it's ever affecting relationships, get a counselor involved right away, because what they can do is help open up those channels where, like, you start to realize, oh, we're thinking the same thing, or, helps the other one understand the other perspective. But when it comes to research, I mean, there's acupuncture. I mean, I want to leave it here to Dr. Salem to answer more, but I mean, there's just so many things. It's just, to me, I think the most important is what works best for you, and that it's working, and never letting get to that point that becomes so severe, So
Yes.
what do you think, Dr. Sam? What do you recommend for your patients for those, stress relief things and stuff?
No, I think this is such a hard part about all of this, Ashley. And I mean, this is, you're in the boat with a lot of other people. Like, this is a very common emotion that people feel, as they're going through this process. It's taxing, it takes effort. We as fertility doctors in our field, we're always talking about, how it's a marathon. It really is a marathon, because sometimes you're feeling good. You're on, mile number 5 or whatever it is. I've never run a marathon, so I'm just making stuff up. But you're on mile number 5 and you feel good. And then, mile number 12 comes around and you're like, oh God, I got another, 12 miles to run. And, I think it's just this up and down feeling with it. And you just have to kind of be able to find out how you can persist long enough to come out on the other end successful. In our field, one of the really interesting things that we've discovered in the last 5 or 10 years by doing qualitative research is that one of the parameters that's most indicative of success is resilience. People being able to stick it out long enough are more successful. That's not a medical thing. That's just, you've been able to keep going through this process long enough to actually let the odds work in your favor. But then the bigger question is, well, how do you develop that resilience? How do you, because different people have different ways of developing that resilience. Some people swear by meditation. Some people, have a best friend they like to hang out and tell everything to. Some people try acupuncture and are very successful with what that gives them, that kind of grounding, stabilizing elements of it. Other people just, intermittently take a break from everything with their partner, and they go on a vacation. They do an IVF vacation. Every time they do IVF, they go on a weekend somewhere to just step away from it all. I've heard of a million different things that people do to develop this resilience. And, just like a marathon, I think very few people, when they first start going through fertility treatment, imagine they're going to go through a marathon, right? They don't want to. I don't want to run a marathon. Most of us don't, but you find yourself in it. And the best thing to do is to figure out, okay, well, how am I going to develop the resilience to come out successful on the other side? And that's kind of my viewpoint on it.
Yeah,
That's great.
It's a tough
Great.
situation. Like I said,
Helpful.
we all
Thank
go through
you.
it.
Yeah. Thank you so much.
Well, you got a great partner that I know is very supportive of you as well. So that's
I do.
important.
Very blessed.
Yeah.
Yeah, but it is important to know what works for him may not be the same for me, and so important just to support one another in that.
Here's a question for you. I had a very interesting case the other day. One patient that I just dearly love. She's been through more than most have ever been through. She's unfortunately has had pregnancies, even had a stillbirth, which from a core accident, just horrible situation. But her partner is supportive of her. But one of the things that's tough for her is that, she knows how much sadness has been brought her. And so, now they're in this situation where I was even mentored. Like, I know as a partner for my wife, like, I don't want her to be sad. And so it's hard. I'm trying to support her, but on the same token, I'm like, man, like this only brings her, unhappiness. And I just wondering, does that ever come up like this? Does he ever sit there and say like, oh, I just feel bad, you're sad all the time? It was a very interesting dynamic. And and I know I've been there before too, like, where I want to prevent my wife from having to go through that unhappiness.
Yeah, man, that's profound. I mean, I think that's probably what I imagine a lot of guys, a lot of partners go through in our field, and I think, this is a bigger topic that I hope we can also dive deeper into in another day. It's the male's role, or the, male partner's role in traditional couples as they're going through this. And a lot of times they feel like they're a passive observer, they say that, or sometimes they feel like they are, along for the ride, but they a lot of times feel like they're carrying the weight of the emotional part of the relationship, because they have to be that kind of more positive energy, etc., because they're not the ones going through the treatment necessarily, and I've heard this too from a lot of people. And I think different guys respond to it very differently. And I don't know if there's one best right way to do it.
Yeah.
I think the couple has to just figure out how they do it together. But I don't know, what's your take on it? I mean, this is just a really tricky one. And I think it's one that honestly we don't talk about enough.
No. It goes back to that point where I think everyone's different. I think the most important thing I would say to anyone is this: use your resources, right? Talk to your clinic. Ask them, do they have resources? And talk to people. I think the groups are great, because I think you just talk to people, who are going through the same thing. But I do think the most important thing is, if it's ever starting to affect the relationship in any way, always get counseling involved. That's to me the most important thing. So Ashley, thanks so much for coming on, and we really appreciate it. And,
Thank you.
Great question. This is exactly why we want people to come on. The show does not only have to be about IUIs tonight. Like, you guys decide the direction of it, and other people were very appreciative of that question you asked. So thank you so much.
Thank you.
Interesting. Like, you're right. I mean, there's that. I think I don't want to use the word guys, but like the dominant partner in a relationship, a lot of times there's this feeling of like protecting your partner. And I know, like I said, I have friends who are same-sex couples who have the same feeling. Like, one of them is just like, I'm trying to protect her. And like, I know for me, it's tough. I felt, I had a problem. So obviously my issue was an issue causing problems, but I can truly say, like, I felt like kind of helpless. Like, how do I get my wife this baby? How do I get it for her? And, it's hard when you have to depend on other people. And that's why, like I said, I know you too. Like, I have so much gratitude for people who will trust me with that. And I do my best, and I feel guilty if it doesn't work. I feel horrible. I mean, I take it all home with me, and I'm just like, God, I wish I could have done that better. But yeah, I think you're right. It would be a really good show tonight, like doing one about guys, and just kind of like, what their feelings are and stuff like that, because there's that balance between the macho-ness of like, hey, I'm here and the strong one, but on the same token, like, I see in the guys, I talk to them, and they're frustrated. Like, they wish they could do something. They wish like they could, make it happen. So we got a lot more questions here, and I think we even have another person available here. So why don't we bring her on? Because again, that's the point of the show. So, hi, Morgan.
Hello.
Hey, Morgan.
How are you doing? Let's see.
We're doing fantastic.
I don't know what I'm doing here. There we go. So we've been on the fertility journey for a few years now. We actually started at a different clinic, and we actually did they recommended us for a IVF trial, which is pretty cool because you can do IVF really cheap. but they're not able to tailor it to you. So we actually went through IVF before we even did any IUIs, and we got a bunch of eggs, but then none of them fertilized. So like that already, like that started pretty rough. And then they recommended IUIs, and we did a couple IUIs. And then I have a friend who actually came to your clinic and recommended it. So we came over to you, and when you looked at our like, look, we did all the testing and everything, and you were like, I don't even know why you did all of that. So like, is it not standard practice? Like, I feel like it's kind of just like the path forward to do IUIs, do 3 IUIs, and then switch to IVF. But like, again, like you say, depending on all the circumstances, age, sperm quality, all of that, like, is that not normal for like fertility places all around? Does that make
Yeah.
sense?
No, it makes a lot of sense. So just so people who maybe don't understand this scenario, let me kind of explain a little bit. There is a clinic in town who does a lot of research. And what they do is they offer people to potentially go in these studies. And as you meant, they're not customized. So unfortunately, like you get the doses you get triggered when you get. So it's not a great cycle, not customized to you. But again, you're right. It could be a low cost fertility treatment. And this is a real big part of their practice. The thing that worries me about more is there's 2 parts to it worries about. So I'm gonna go with the first part on the patient side that worries me, and that is IVF is the best thing we have. There is no IVF 2.0. I always point this out. When you fail IVF, I don't care if you're in a trial. I don't care if like even someone told you it may not work. You feel like you are never going to have a kid.
Yep.
It's such a scary feeling because you're like, that was the best. And that didn't work. And so that's my fear I have when people jump into something like that. I even make the point to people all the time. Whenever you hear about someone saying, oh yeah, my friend got pregnant naturally and they had to do IVF the first time. Almost always they jumped into IVF and they didn't need to. It was usually someone who just got impatient, they did IVF, and they never really absolutely needed it. Now, that being said, there's nothing wrong with people jumping to IVF first. I think a lot of people look at it as like a financial decision sometimes. They look at it and go, chance of IUIs are expensive. There's places in California that charge more for IUIs than we charge for IVF. I mean, after doing 3 IUIs. So for that reason, a lot of people will say, I'm just going to skip the IUIs and go to IVF. But the thing I always remind people is that there's this fear of if it doesn't work, it's really important to explain to the patient, like, it doesn't mean it's not going to work. Dr. Salem talked about earlier, that resilience of just doing it again. Almost everyone, if you do it enough, will eventually get there. In the situation, I looked at it again. I didn't tell you anything was wrong. I just said, wow, what was all this? Like, you're young, healthy, like, know, but it was a study. I get it. And in a study, it's different. You put people through that you normally wouldn't put through in other situations. But you tell us, I mean, when it failed, was it harder than just an IUI failed? I mean, did you feel like, oh my God, is this ever going to work?
Yeah, I mean, again, like IVF is supposed to be better than that's like the step up above IUI. So doing like a whole IVF cycle and then not even getting like an embryo, we didn't even get past that. Yeah. Like that's pretty rough because then it's like, well, then what's the point of doing an IUI? If we couldn't do an IVF cycle, then why are we doing IUIs? But that was what was recommended. So that's what we ended up doing. And it's just like, I'm a very, like, I wanted to get pregnant. I was ready to get pregnant. And then like my patience, just like, I'm not a patient person. So it was just very hard to go through that. But like, yeah, I guess switching over to your clinic, it kind of like reset us because we were able to, I don't know, just getting your input on it. Like it kind of made us feel not as much of like a failure after doing all the treatment that we already did. So
correct.
Yeah.
And
so
it was a study. And that's the thing. You can't look at it as like, it wasn't like someone customized it, looked at your situation and said, this is what's going on. And that's actually the same thing with a second opinion. So for someone who didn't go through a study, maybe you went to a clinic and it didn't go well, a second opinion is kind of that same thing. It's looking at and going, okay, is there any other areas we can change? And again, we looked at yours and we found out areas that we could improve. So
Yeah.
Yeah, no, I think I mean I think you hit all the highlights. I don't know if I have all that much more to weigh in there. No, I think that's perfect. I mean, um I think maybe I'll just touch on one part of this, Morgan, which is you said, well, it's kind of nice, like on the study, you obviously got to go through IVF at a very low cost.
Cheaper than IUI. Yeah.
Right. And so in a study, I mean, very technically in most studies in medicine, I would say one of the questions you should ask is if it is not, if it's free, the study's totally free to participate in, who's sponsoring it? Like, how is it that I'm getting, free treatment, free medication, and what's the purpose of that study? And how am I as an individual benefiting? Because I think that those are good questions to ask, at any stage. We run a lot of studies as well, at our clinics, Dr. Amols and I. And so those are always questions that we want, people to engage with us about, because you should be an informed consumer if you are in a trial or in a study. I think the flip side of that, though, of course, is this idea of customization, because there's even a ton of customization that happens with IUI. There's been studies showing that we should actually push the follicles a little bit larger compared to IVF. There's studies showing that the lining thickness is very, very critical with IUI. Studies showing, again, how many follicles is kind of that sweet spot in terms of trying to optimize for success rate. So I think there is a lot of customization, and so there's so many variables that you have to kind of take all of those things into account as you're doing. So I would just say that, in our field, of course it would make things easier for us if this weren't the case, but there's an enormous amount of customization. And when you do studies, what you're trying to do is de-customize. You're trying to make everything standard, which is if you're doing a study.
Yeah, and actually, so we actually went through IVF as well. And with the customization, we were able to do ICSI and everything. We actually were able to get some embryos. So it's a positive story. But it was just a long process to get there. And it just felt like there were some unnecessary steps. So I guess just however we can help people skip past those unnecessary steps, because it's very emotionally taxing and financial and all of that kind of stuff. So
as I told you that day, as I said to you, you're not the first person that's gone through that scenario. Yeah. And I've had people take a year or two off because it was just so demoralizing. And that's the hard part. I think it's just really important, whoever's doing those studies, to make sure people know, at least have some type of outlet afterwards, like, hey, keep in mind, this was not customized to you, that I don't think this means is how we'll go for the future. So, well, thank you so much, Morgan.
Thank you.
Thank you. Yeah.
So one thing she brought up that kind of like, it made me think was, she said something about the thought of, well, kind of this IUI thing versus IVF. Someone asked a question similar to this, and one of the things is how does it work naturally? But like should I do an IUI if IVF didn't work? And that's a kind of a tricky thing, because I always remind people that when we're doing IVF, it's not natural. When sperm has to go through the reproductive tract, I mean, you're talking millions of sperm down to 50 sperm get into the egg. When we fertilize the eggs naturally, it's 50,000 sperm per egg concentration. Clearly, we're not as good as nature. If nature can do it with just 50 by the time they get there. And so I don't think you can make that argument that if you did a study and it failed, that you can't do IVF. And can't do IUI. And this is actually, I see a lot of these patients from this clinic, and I won't name them or respect, but I see these patients, and I have to talk them into doing IUI sometimes. I'm like, no, you just need an IUI. Like, I understand you're in a study, but you need to be in the study. And so I do think that's an important thing, because that's one of the questions someone asked was, hey, if you did IVF and let's say, it came back abnormal, your embryos or something, is it kind of crazy to go to IUI? And the answer is Not always. It just depends on what you were doing IVF for, and if one might be a better situation. So my argument I make, and I'd love to hear what you think, is if you only make 3 eggs every time you do IVF, right, and you don't have a blocked tube, you don't have a sperm issue, you might benefit more by doing IUI just because of that, as you said, resilience, getting more tries for the amount of money you might be able to put into it, right? Obviously, if everything's free, everyone's doing IVF forever. We're all doing, let's make it free and we're all doing it. But if it's not, those are real things. And so what's your take on that? That part she said, she didn't ask a question, but it was something she said, and I saw one of our patients ask a question like that. So
no, I mean, like, this is a really important point, because especially we see some of this start to happen in a couple different groups. One group is the group that has unfortunately gone through a couple cycles. They're 42, 43, something like that. They're getting 1 or 2 eggs from an IVF cycle. IVF is so costly. It's not covered by insurance, et cetera, et cetera. And they're like, do I have any other options? And, this is, again, where it's interesting to kind of take a step to the side. I don't even call it a step back, and to say, what are we treating? And so, maybe this is the type of person who's previously had a natural pregnancy. So we know fertilization, at least historically, has worked for them, et cetera. And in those type of cases, it might be reasonable to try an IUI cycle, with the big caveat of, like, listen, we know the odds are not high, but because the odds are also not very high with IVF is still going to have higher odds. But is the exchange worth it now? And for some people, they're like, that's an interesting argument. Maybe I want to try 2 or 3 more cycles of IUI before I go to donor egg. And that's the kind of thing, though, that they need to, I think, that helps, wrap it up, kind of understanding, like, where's the end of the line? How far do I want to keep going with these IUIs? Understanding that this isn't a sure bet as I go through. And again, I think there are different categories of patients that can really benefit from doing that. One group that we haven't talked a lot about, and I just want to give it at least a few minutes, is our same-sex couples. We have a lot of same-sex couples benefit a lot. We talked about it a little bit in the beginning, that benefit a lot from, IUI with donor sperm. And I'm just curious, like, okay, when you have, a young couple coming in, same-sex female couple, they're planning on using donor sperm, what are the highlights of IUI? What do you tell them in terms of their success rates? Because, this is interesting. They always come in, there's like, well, I'm not infertile.
Yeah. Well, I mean, we know, though, that 1 out of every 6 or 7 are going to be infertile, right? So it's not that far off to be infertile. When I meet with couples who are from the LGBTQ community, or even people who are using donor sperm, I tend to not treat them as treating that pregnancy, but actually try to build their family with them and say to them, what's the goal? Is the goal 1 pregnancy? Is the goal eventually your partner to carry pregnancy? And I have to take all that into consideration when I'm making suggestions. Because, for example, if someone tells me they want 4 kids, IUI actually doesn't make any sense. Cost-effective wise, they would be better for them to go through IVF, make these embryos. Now, all these embryos have the same maternal DNA, and they just keep having siblings as they want, right? So that's a situation where IUI would be wasteful. On the same token, some people want to do IUIs. I have to know, well, do you want another kid in the future? They say, yes. I have to let them know that sperm may not be there in the future. You might have Brad Pitt's sperm there and everyone wants it. So now it's gone. And so you can't, you won't have it there for the future. And so I have to tell them, you need to have the extra sperm available just in case you want to have that next kid. So have another 3 vials of sperm available. And that can be very expensive. So it really, I think it's a very unique population. And I feel like a lot of doctors don't do that. I can't tell you how many patients I've seen where they're like, have a kid, and they want the next one, they're like, the sperm's not available anymore. And it's not the end of the world, but still, they didn't want it that way. Yeah. And so I think that's why it's so important to have the forethought of, like, what's the goal here? And same thing, like if someone's like, hey, my partner doesn't want to ever, be pregnant, but she wants a kid, well, then we're gonna have to do IVF for them at some point, right? So if you're going now, but they're 36, I don't want to wait till they're 38. That's bad. Let's get their eggs out now. We don't have to be pregnant now. Now you get pregnant with your IUI, but we have her embryos stored for the future. So then when you're ready, now when she's 38, 39, her chances are better now because we got the eggs at 36. So I think IUI is a great option. I think the problem is, and you and I have had this conversation many times, I think the sperm storage companies that sell sperm are just making a ton of money right now. I think they know right now they have a cash cow with the LGBT community, and I think they're just, loving it. And so the problem is that IUIs are great, and they're usually affordable. That's the reason people do them.
Right.
But the problem is that when you have to spend $1,000 per vial of sperm for something that has less than a 20% chance per try, it becomes very ineffective unless you're at a place where you can get lower. So it's tough. It's that, and it's a hard line. I like I said, I have to look at each situation different. So.
Yeah, I think that's the big. I think you like, for me, that's the really big thing too with IUIs and our same-sex couples and our LGBTQ community is this idea that donor sperm has become so expensive, and it's unfortunately really like eaten into the value prop of doing these IUIs. Especially when you need to do 2, 3, 4 IUIs each time you're buying sperm at $1,000. Again, it's something just to think about. And I think that the important thing that I would just like hope everybody talks to their own doctor about is, hey, here's what I want to do. I want to get pregnant, but let's talk about my bigger family building goals. We want 2 kids. We want 3 kids. Each one of us wants a kid. We each want to carry. Each one of us wants a kid, but only I want to carry, and those conversations should be had in the very beginning. That's that planning that kind of, hopefully, you can all make a decision together about what's the best way to get there. And again, IUI might be perfect. A lot of times it is. And sometimes IVF might be the better place to consider these things.
One thing I was thinking to do is, before kind of wrapping up, because we're at 7 here, there was 2 general themes I saw of questions here, and I think they're good to answer. One was this idea of like, hey, like, if IVF fails, can you get pregnant with an IUI, or can you get pregnant naturally? And the answer is yes. I think it just depends on why you had to do IVF. So if this is a situation where, like a study, then you might get pregnant naturally. If you're like in my situation, my wife, trust me, I pray every day we get pregnant naturally. And we're 33 something years into this relationship and still have never got pregnant naturally. So the point is that it's not folklore that people get pregnant after IVF, but never count on that. Like, those are the stories you hear because it doesn't happen much. But the thing is that, talk to your doctor. There are times where, yes, it's not unreasonable to go back to IUIs, even if IVF fails. And I've had many pregnancies from IUIs. Anything to add to that you have?
No, I mean, I think that's great. I think that, it's not a one-way street. That's the one way I'll put it. It's not 3 cycles of IUI, then IVF everybody. If you're getting that standard algorithm, then you're getting a standard algorithm.
Yeah. Exactly. I agree completely. And then just summarizing, like with IUIs, there's a place for it. There's definitely a place for it. Unfortunately, like I said, there are a lot of clinics, and this is not to bash other clinics. There's nothing wrong. I always say, doctors do the things they do because they feel comfortable doing it that way. So if they're doing it that way, it means that's the way they feel comfortable with it. But I do think it's important, if you are doing IUIs at your clinic, that, it is, when I say customized, just it's appropriate for you. Again, a 4-year-old woman doing Clomid IUIs, unless it's being done because they're saying, hey, nothing's going to work, but if you want to do it, fine. But it should be always adjusted to the person, And so one of the questions asked was, how many eggs are good enough? It depends on the person. If you're 42, I want to make 4 or 5 eggs. If you're 22, I don't want to make that many eggs, because then I'm going to be on the news with you, because you had too many babies in you, and so we're both on the news, which isn't really good publicity at that point. So, anything to add to it about the IUIs? I mean, like I said, I do lots of them. I do like IUIs, but it's not for everyone. There are people who come in and I say, you can do it. I would not waste your time. I don't think it's going to work, but we can try it.
I think one last thing, since I promised we would get to this, is this idea of cost of IUI. So across the country, one of the things that I've been really interested in is exploring the cost of IUIs. And it's amazing how much of a disparity we're seeing across the country. There's actually much higher disparity in the cost of IUIs across the country as opposed to cost of IVF. So it's one of those things that's important for everybody to just really, ask the honest questions about, hey, if I have a financial responsibility for IUI, what is it? What does it look like? The current kind of studies that are out there are showing the range of IUIs being, and I kid you not, anywhere from $800 to $7,000 for an IUI. Yeah, and that upper number, while rare, is not unheard of. And I think I just want patients to always advocate for themselves. Ask, hey, if I'm doing this, what's going to be my responsibility for that package price of the IUI? And again, the reason I've been interested in this is because we're always looking for what offers our patients the greatest value in also getting to their goals. And when I saw some of these numbers out there, as I was compiling some stuff for the studies, I was really kind of shocked. So just a little tidbit. I thought it was interesting, and I'll leave it all on that note. IUIs are great. Make sure you're asking all the right questions.
Yeah, that's a really good point. And you're right. I think it's important to find out, are they charging for every ultrasound? Is it a package price? Is the package include if it goes past a certain amount of ultrasounds? Because you're right, there's probably nothing more frustrating than, starting that cycle and then finding out it costs double what you thought it would. So,
yeah.
Well, we'll take all these, everyone who's done the questions, we will take the people who come on live, and we will, on the next show, we'll be announcing the winner, and hopefully if we get in contact with you, we might even have you on the show accepting it. So thank you for everyone that's been here, and hopefully we were able to answer some of your questions. We know we didn't get to every single one, but we honestly prefer the live questions even more than the written ones, just because there's at least that conversational piece. So thanks everyone. Have a great night. We'll see you again in 2 weeks. Bye-bye.
Bye.